Ticks are on the move, but many doctors still don't know what they're dealing with, a critical gap in public health preparedness. In Montana, biologist Grant Hokit is out in the wilds, swiping white cloth across grass and shrubs to track these tiny invaders. His work is part of a broader effort to monitor tick populations, but the challenge is clear. Limited resources and inconsistent surveillance leave medical professionals guessing when new threats emerge. But here's where it gets controversial. Should states prioritize tick surveillance over mosquito control? Hokit's mission is simple. Find ticks, identify them, and alert officials to potential dangers. Yet his team struggles to cover the entire state due to budget constraints. We're like detectives searching for clues in a vast landscape, he says, highlighting the difficulty of tracking shifting tick populations. And this is the part most people miss. Patients rarely report tick bites immediately. By the time symptoms like fever or fatigue show up, the window for diagnosis has already closed. Dr. Neil Koo, an infectious disease specialist, explains that many patients don't connect their illness to a tick bite, and even fewer keep the tick for testing. This delay complicates efforts to link symptoms to specific diseases. The stakes are high. Deer ticks, first spotted in Montana earlier this year, are notorious for spreading Lyme disease. But identifying these threats requires more than just finding ticks. It demands understanding which species are active where and whether they carry pathogens. It's like trying to solve a puzzle without seeing all the pieces, says Devin Cozart, a public health expert. We need data to predict where risks will rise. Yet not all states are doing this. A 2023 study found that only a quarter of health departments conduct tick surveillance. A glaring oversight in a world where climate change is expanding tick habitats. For some areas, the solution is passive. Patients, vets, and doctors submit ticks for analysis. But this approach misses the bigger picture, how common ticks are in a region, and how often they carry disease. Montana, for instance, receives $60,000 annually from federal grants, but most goes to mosquito programs. What's left funds field trips, leaving Hokit's team under-resourced. He's watching deer ticks spread in 2 counties, but can't confirm if they've started reproducing locally. Still, he uses climate data to forecast where these ticks might thrive, focusing on areas like the Flathead Valley. The question remains, should public health systems invest more in tick surveillance? Or is it a luxury in a world where mosquito control takes priority? As Hokit puts it, we're racing against time to protect people before they even realize they're at risk. What's your take? Comment below and share your thoughts on this urgent issue.